So how else has the pandemic impacted cancer patients and the doctors who treat them? Well, for expert insight, I spoke with Dr. Dmitri Alden. He's a liver cancer surgeon and surgical oncologist at Lenox Hill Hospital in New York. And we started off by discussing how the pandemic changed treatment for some cancer patients. Let's take a listen.
What people don't really think about is how the changes in technology have impacted the access to care. And we are speaking on Zoom right now and other different platforms. I'm not going to name them, but they allowed patients to get to their doctors very quickly, to ask the necessary questions, to have an appointment from their home without issues of transportation and difficulties of displacing, especially for patients who have debilitating diseases like cancer, who are undergoing chemotherapy and have difficulties coming to the office, or by coming to the office are risking of contracting not just necessarily COVID, but other diseases such as flu and so forth. So technology has improved access to care in many ways. What the problem is that in a lot of situations, there's a disparity in socioeconomic level of patients who can have access to this. A lot of patients don't have computers. A lot of patients don't have access to stable internet connections, and these people suffer much more than those who are in a better socioeconomic position with all the technology available to them.
So it really does seem to be a really coordinated effort as being the solution. I want to talk specifically now about COVID and its relation to cancer. Is there any sort of correlation, and how are they really factoring in vaccine trials when it comes to cancer patients?
I think it's actually very interesting because cancer and COVID are interconnected and intertwined in many ways. On the one hand, patients who have cancer obviously have the highest risk of developing major complications from COVID. They have higher risk of infection, and they have higher risk of death. But what's interesting is that a lot of the research that's been done in cancer helps COVID research, and a lot of the research that's being done in COVID may in the future help treatment of cancer. Why? Because both diseases are immunology related. Both diseases affect immune system dramatically. The reason patients get so sick and die of COVID is because they have what's called cytokine storm, which is basically deregulation of the immune system triggering massive immune reaction. But patients who have cancer, their immune system is majorly compromised, usually by cancer itself and the chemotherapy and radiation therapy that they're taking. So they're, on one hand, more vulnerable. So a lot of the treatment in the past was developed to stimulate the immune system and help the immune system inside the body to fight the cancer cells. But the mechanism is very, very similar in fighting COVID. So a lot of the drugs that, not a lot, but several drugs that are being developed right now, and they're in trials they come from cancer research.
I mean, that's really fascinating. So given that correlation then, are you seeing much in terms of more fundraising efforts for cancer in light of COVID, or have the donations and fundraising gone down?
Well, I think generally, globally, the donations have gone down because we were at war with COVID, and I think every single resource that was out there was thrown at COVID. But like I said previously, there's a side benefit to cancer research from COVID research, and I think in the future we'll see that more and more.
And are there any lessons that can be learned from other times of recession or natural disasters when funding did have to shift for emergency reasons? Are there any lessons that could be learned in terms of really shoring up the contributions for cancer while these things are also going on?
The lessons can be learned, and the lessons that we see is what we're experiencing today. I think the level of support that you get from the institution to individual physician, the level of collegial collaboration between different physicians, it's unprecedented. And I've been in private practice for close to 20 years, and I work individually. But I have to say that I've never seen a better collaboration with my colleagues that I've seen during last year. It's unprecedented. It's friendly. And altogether, we're able to treat patients with better. We have better outcomes. We have better solutions. And we're collaborating on research projects. And also, it's not just in one institution. It's interinstitutionally. It's on a national level and on an international level as well, because I'm a member of several international organizations. We communicate regularly. And an advancement that we made during last year, just collaborating on discussing cancer cases and various treatment options, have advanced the situation so much further than comparing to where we were a year ago.